From the PEHSU National Program Office, welcome to Pediatric Environmental Health Radio, a podcast that highlights stories from leading experts in pediatric environmental health across the U.S. The PEHSU National Program Office supports a network of 10 regional PEHSUs across the nation whose vision is to create healthy environments for all children. For more information, go to PEHSU.net. I'm your host, Whitney Sturton-Hall. Today I'm excited to talk to two pediatricians and PEHSU experts, Dr. Marissa Hauptman and Dr. Nick Newman. So let's start with introductions. What are your current roles with the PEHSUs and how long have you worked there? Dr. Hauptman, let's start with you.
Wonderful. Thanks for having me on today. Hi, I'm Marissa Hauptman. I'm a pediatrician at Boston Children's Hospital, and I'm the co-director for our Pediatric Environmental Health Center here, as well as the co-director for our Region 1 New England PEHSU, or Pediatric Environmental Health Specialty Unit. I've been at the PEHSU for 10 years now in Boston, and prior to that, while I was in medical school in New York City, I collaborated with our Region 2 colleagues at Mount Sinai.
Thank you for inviting me on the podcast. I'm Dr. Nick Newman. I'm been part of the PEHSU network for over 16 years, and I'm based at Cincinnati Children's Hospital, and I'm currently the Associate Director for the Region 5 PEHSU, and our home base for that is the University of Illinois at Chicago.
Thank you both. That's amazing. 10 years and 16 years. That's a lot of history. Before we get into talking about lead, what sparked your initial interest in environmental health in pediatrics?
You know, I've been interested in the environment my whole life, and I was even the president of the recycling club in high school back in the 80s, so I've had a long history of being involved with trying to improve the environment. And my interest in pediatric environmental health started when I was in private practice in Michigan back in the early 2000s. A group of pediatricians, we all got together with other members of the Michigan chapter of the American Academy of Pediatrics, and we created actually a committee on environmental health. And as a group, we got together and reviewed some of the literature at the time, and then we started doing education and outreach for pediatricians around the state regarding like all kinds of environmental health topics like lead and endocrine disruptors and like other toxicants, and help to raise awareness around the problem. And ultimately, we sponsored a conference in Ann Arbor that brought a whole over 150 people together to learn more about it.
For me, it was, my spark was lit prior to going to medical school. I always knew I wanted to be a pediatrician, but found my way into a public health program at Brown University, and right when the Rhode Island Attorney General, Sheldon Whitehouse, was suing the lead paint companies for creating a public nuisance. And I learned that there's many more ways to help and protect health of children, especially before a child ever gets sick, and by focusing on the home environment and healthy housing approaches. And so at the time, one of the paint companies donated funding to the state of Rhode Island to clean up housing and lead contamination in 600 housing units. And so I came in as a graduate student and was leading this work with my mentor, Patrick Vivier, to figure out, using evidence-based approaches, how to leverage public health data at the state, as well as publicly available data sources, to really identify communities that have been disproportionately impacted by lead and where this funding would have the biggest impact. And so we designed a whole program around leveraging this analytic process and then investing in those communities that were disproportionately impacted. And so from there, I was sort of hooked at the ability to prevent disease and neurodevelopmental impacts before a child ever has to get sick, and learned all about lead poisoning from the public health perspective, and was inspired about the intersection of public health and pediatrics that have continued to this day. And so I found my way at medical school at NYU, but learned of an incredible environmental health summer program up at Mount Sinai to do during my first summer, where I met Dr. Maida Galvez, who runs our Region 2 PEHSU, and from there was inspired and hooked ever since, and continued to travel along this journey of the intersection of public health and medicine and the power of that partnership.
So cool. Thank you both for sharing. So we've kind of already transitioned a bit into talking about lead. Lead is the number one inquiry that the PEHSUs get contacted about, so I'm sure there's a lot to talk about. But Dr. Hauptman, starting with you, I know you have several campaigns in your region about lead going on, like Take the Lead on Lead. Can you share more about your lead-focused work and programs with listeners?
So, despite lead being banned in our paint supply and gasoline close to 50 years ago, it still persists to be a problem today, and still persists because of some of the nature of lead in our paint supplies and in our soil, and in also new and alternative sources of lead. And so some of the programs that we've been thinking about is how to move lead poisoning prevention upstream. And one of the programs that we developed over the last year is something called Take the Lead on Lead, and it is a partnership that I developed with pediatric residents at the Boston Combined Residency Program, Ryan Brewster, as well as in partnership with colleagues at Boston Medical Center. And it's really to try to address the gap of when a pediatrician may inform a family that their child has lead exposure from lead testing that is universal in Massachusetts at the ages of 1, 2, and 3, and 4 if you live in a high-risk community, and when potentially there may be a big gap between when public health is able to mitigate the exposure. And we saw potential for this program to even move it further upstream and potentially enroll newborns to do what we call a lead identification visit, where with a clinician who's trained in lead poisoning prevention and environmental medicine, or even other colleagues it could be expanded to, you go around the home in a virtual platform and try to identify where some of the lead hazards may be. And also through the PEHSU network, we've been able to receive some grant funding to provide what we call lead mitigation kits to these families. So they can pick up, or we can send them one of these kits, and it has a paper towel roll, it has gloves, it has duct tape, which can be incredibly helpful just to do something to minimize chipping and peeling paint in a home, to minimize that source of lead exposure. It's not a permanent fix, but it at least can sort of help reduce that hand-to-mouth exposure, as well as some lead testing indicators. And so this isn't a lead inspection, but it's at least helpful to have a clinician guide families through what they can do to minimize lead risks in their home. And we launched this program because as a result of the COVID-19 pandemic, we were doing a lot of virtual medicine visits and saw the potential of seeing a patient in their home environment and seeing where some of the hot spots of lead could be, and trying to partner with families to minimize that risk.
Great, thanks for sharing. And Dr. Newman, what is your work like at the Environmental Health and Lead Clinic in Cincinnati? So, what kind of populations are you serving, or trends that you're seeing when it comes to inquiries about lead exposure in kids, either from parents or healthcare providers?
Well, we care for kids in Ohio, Kentucky, and Indiana, because Cincinnati is in a tri-state area right on the Ohio River. And we take care of kids for urban, suburban, rural, like anyone in our area, we'll take care of. And they all come like referred generally after someone has checked a lead level. And the environmental health clinic's been surprisingly busy over the past couple years with new referrals for lead exposure. And we're seeing more kids who may have missed lead testing at age 1 or 2, like maybe, during the height of the COVID pandemic, and now have elevated lead levels at age 3 to 5. And sadly, like we've also had a lot more kids than I'd like to see who need hospitalization for treatment of acute lead poisoning, which is, something that we're really all trying to prevent. The other trend that we're seeing is a good number of kids we get called about who are exposed to kids through contaminated food items, which was something that we didn't see that much of about 10 or 15 years ago. And I don't know if that's because there's maybe more testing going on or there's more awareness, but it's definitely something that's gotten some attention, both by us and also you see it in the news too, right? And we've been working with the Ohio chapter, the American Academy of Pediatrics, and the Ohio Department of Health on some projects to improve lead testing and follow-up around the state. And we might also be seeing the effects of that. There are more pediatricians who seem to be more aware of the problem and are like more active in trying to identify kids who are exposed to lead.
Thank you. Yeah, that's really interesting about COVID. For both of you now, what is a standout lesson that you've learned, or, when you think back about some kind of key impactful moment you've had when it comes to working on lead, either in education or prevention or crisis response?
So over the years, like I've had a role in following some kind of environmental disaster or like contamination event or something like that, a crisis. And the main role has been in talking with healthcare providers in the aftermath of things like the water contamination in Flint, Michigan, and then over the years a number of other chemical exposure events in Ohio. And having participated in those, it stressed to me how important it is to get the word out about the PEHSU ahead of time, so that clinicians know who they can call to get evidence-based information about environmental exposures in children, because it's really an area that not that many people know that much about, and the families and the kids are often kind of left in the middle, like wondering, like what's going on? Should someone be doing something? Why aren't they doing anything? And it's very easy, to find information on the internet, but often, it's also really easy to find poor quality information if you just rely on searching the internet for answers about things like this. And so, it stressed to me like how important it is to get the word out about the PEHSU before something happens, so that people know who they can call to get good advice.
I think those are great tips. I think one of the standout lessons that I think about is that lead is really the tip of the iceberg in terms of environmental medicine, environmental hazards, and there's so much that we've learned about environmental health over the past 50 years that can be applied to other environmental contaminants or hazards. And medicine, I always say, keeps us humble, and I would say public health does as well, that that lead is both an amazing public health success story, but also highlights the importance of really moving our environmental regulations upstream and testing chemicals for possible health effects before they're even put into our environment, and having safeguards to try to minimize risks to communities, and supporting in communities in addressing hazards. I think also it highlights the success of public health partnerships and the amazing work that public health departments are doing across the country and at the Childhood Lead Poisoning Prevention Program and CDC to support families in identifying lead exposures and trying to minimize the time that a child is exposed to and minimize both the dose of the exposure as well as the duration. And I continue, despite the fact that when I first started to learn about lead, I thought it was a problem in the 70s. It continues to sort of inspire me and also teach me about how our world works and how the vulnerabilities of children and how stressful being told that your child has a lead exposure can be, and working incredibly hard to try to prevent any of those diagnoses.
Along those lines, if you could give a caregiver or parent or a healthcare provider one piece of advice about lead or screening for lead exposure, what would that be?
Great question. I think there are a few things I tend to say a lot in clinic, and I'm also a mom, and I think if you let it, you could sort of really go down a rabbit hole, thinking about all the chemicals and that we're exposed to on a day-to-day basis. But although we can measure lead in the blood, we can't measure all the amazing things that you're doing to help raise your child, and all the books that you're reading to them, and all the times that you're playing with them, and you're doing artwork, and you're trying to minimize their screen time, and all the things that you're doing to foster their development. And all that matters a ton, and all the love that you give that child. And lead is one factor, and I think it also doesn't affect everyone equally. And so trying to minimize both that dose and duration of lead exposure that the great father of toxicology would say, Paracelsus, that the dose makes the poison, and that is certainly true in lead. And so trying to minimize that dose and the duration of exposure, and trying, if you are able to have choice in your housing, to think about minimizing lead exposure, whether it be getting an inspection or asking your landlord whether it's ever been tested for lead, and even if you're not able to do that, to do, if you're able to have that test after moving in, and knowing that there are lots of state and local partnerships to help you minimize lead exposure in your home. So I think those are the lessons that even if you're a patient and have been told that your child has an elevated lead level, to not let it paralyze you, but know that all the things that you're doing to support their child development do make an impact. And there's been lots of studies that have shown that a referral to early intervention and having really strong early childhood education can help minimize the later academic impacts of neurodevelopmental impacts of lead. And so I think those are some of the tips I'd give a family.
Thinking about your question, I think like how I would frame this to, a pediatrician who maybe is like, well, why do I have to do all this? And, the testing, the follow-up for lead. And, I would just say lead exposure is a major cause of preventable learning disabilities. And doing a blood test is the best way to find out if the child has been seriously exposed. I kind of see it how like we do routine cholesterol screenings. At a certain age, you check the cholesterol, and if it's okay, you move on. If it's not, we have an intervention. But you won't be able to do anything about a risk factor without doing the test to identify it. And so I see it's just the same as all the other preventive activities that we do. Like we're looking for risk factors, we're trying to modify them so that we can help people be healthy and and avoid, unnecessary illness.
Yeah, it makes a lot of sense. Well, for people who live in your region and may be concerned whether they're, a parent or caregiver or healthcare provider and want to talk to, either of you or another expert in the PEHSU, how do they get in contact with you? So what's the best way to pursue that?
For me, like our phone number at Cincinnati Children's for our environmental health and lead clinic is 513-803-3688, and we're on the Cincinnati Children's website under environmental health. And like I said, we care for kids in the the immediate Ohio, Indiana, Kentucky area, and the Region 5 PEHSU is on the web at childrensenviro, one word, .uic.edu.
And for me, I'd just like to highlight there's a national PEHSU website, www.PEHSU.net. And there you can find your regional PEHSU across for your location, where there are 10 PEHSUs across the country, and we're aligned with each of the administrative regions. So in Boston, we're the home of the PEHSU for all of New England. So Connecticut, Rhode Island, Massachusetts, Vermont, New Hampshire, and Maine. Our website at Boston Children's Hospital for our Region 1 PEHSU is www.childrenshospital.org/PEHC. And hopefully this will accompany the podcast. And then I'd also just like to highlight the strength of your state childhood lead poisoning prevention programs. They tend to have a lot of incredible resources, are really incredible experts in your local environmental regulations and housing laws, and lots of states have registries, so or databases where you can look up your address and figure out what prior inspections have been done on it that are publicly available, and usually pretty accessible through the state websites, and often have a toll-free phone number as well. And but I would encourage you to talk to your pediatrician if you have concerns about lead exposure. The earlier the better, and especially if you have concerns if your child has pica behavior where they put a lot of non-food items in their mouth. Really talking to your pediatrician about your home environment, your child care or school environment, and what risk factors you're concerned about for your own child, and how to prevent lead exposure.
Thank you. All great advice, and I'll be sure to add those notes, the website and phone numbers in the show notes too for the podcast. But thank you both for being on and sharing with listeners your expertise on lead, and thank you for all the work you do to keep kids and families safe from environmental hazards. It was great having you both.
Likewise, nice chatting with both of you.
Yeah, thanks for inviting me.
Thank you to our guests, Dr. Marissa Hauptman and Dr. Nick Newman, and all of you for tuning in to Pediatric Environmental Health Radio. This podcast is a project of the PEHSU National Program Office, supported by the U.S. Centers for Disease Control and Prevention's Agency for Toxic Substances and Disease Registry, and the U.S. Environmental Protection Agency. The Public Health Institute serves as the national program office with advisory support from the Association of Occupational and Environmental Clinics. The findings and conclusions in this presentation have not been formally disseminated by CDC, ATSDR, or EPA, and should not be construed to represent any agency determination or policy. Use of trade names that may be mentioned is for identification only and does not imply endorsement by CDC, ATSDR, or EPA. Please join us next time as we share more pediatric environmental health stories. To learn more about our program, find resources, and see how we are making meaningful contributions to pediatric environmental health, visit our website at PEHSU.net. This podcast is produced by Whitney Starton Hall. Our graphic element was drawn by Robin Hall, and our theme music is by Roman Kano.